Multiple sclerosis, or MS, is a chronic illness that affects the central nervous system. The central nervous system is made up of the brain and spinal cord. These parts of the body control everything we do, from thinking and feeling to moving our arms and legs. In MS, the immune system mistakenly attacks a substance called myelin. Myelin is a fatty substance that surrounds and protects the nerve fibers in the central nervous system. Think of myelin as the insulation around an electrical wire. It helps nerve signals travel quickly and smoothly. When myelin is damaged, these signals are disrupted, leading to a variety of symptoms. The exact cause of MS is unknown, but it is considered an autoimmune disease. This means the immune system, which normally protects the body from foreign invaders like viruses and bacteria, mistakenly attacks the body's own tissues. In the case of MS, the immune system attacks myelin, leading to inflammation and damage in the central nervous system. The immune system is a complex network of cells and proteins that defend the body against harmful invaders. It works by recognizing and attacking anything it perceives as a threat, such as bacteria, viruses, and even cancerous cells. However, in autoimmune diseases like MS, this system malfunctions. It begins to identify the body's own healthy tissues as foreign and attacks them. In MS, the immune system specifically targets myelin. Myelin is essential for the proper functioning of the nervous system. It acts as an insulator, allowing electrical signals to travel quickly and efficiently along nerve fibers. When myelin is damaged by the immune system, communication between the brain and the rest of the body is disrupted. This immune system attack on myelin is the hallmark of MS. The damage to myelin can occur in different areas of the central nervous system, leading to a wide range of symptoms that vary from person to person. The unpredictable nature of these attacks and the resulting damage is what makes MS such a challenging disease to live with. Multiple sclerosis is not a one-size-fits-all disease. It manifests in different forms, each with its own unique characteristics and progression patterns. Understanding these different types is crucial for determining the best course of treatment and management. The most common type is relapsing remitting MS, or RMS. As the name suggests, RRMS involves periods of new or worsening symptoms known as relapses or exacerbations, followed by periods of remission. During remission, symptoms may disappear completely or partially, and the person experiences a period of stability. Secondary progressive MS, or SPMS, often follows RMS. In SPMS, the disease begins to progress more steadily, with or without relapses. This means that disability gradually worsens over time, even during periods when relapses are not occurring. Primary progressive MS, or PPMS, is characterized by a steady worsening of symptoms from the very beginning without clear relapses or remissions. It is less common than RRMs and SPMs. Finally, progressive relapsing MS, or PRMS, is the rarest form. It involves a progressive course from onset similar to PPMS, but with clear relapses along the way. These relapses are superimposed on the steady progression of the disease. Multiple sclerosis is often called the disease of 1,000 faces due to its wide range of unpredictable symptoms. These symptoms vary greatly from person to person and can change over time, even in the same individual. One of the most common symptoms is fatigue, an overwhelming sense of tiredness that is often described as debilitating. This fatigue is not relieved by rest and can interfere with daily activities. Numbness or tingling sensations are also frequently experienced by people with MS. These sensations can occur anywhere in the body, but are often felt in the extremities, such as the hands, feet, arms, and legs. Muscle weakness is another hallmark of MS. This weakness can affect any muscle group, making it difficult to move, walk, or maintain balance. In some cases, muscle stiffness and spasms can also occur, leading to pain and discomfort. Visual disturbances are another potential symptom of MS. Optic neuritis, an inflammation of the optic nerve, can cause blurry vision, double vision, or even temporary vision loss. Eye pain and difficulty with color perception may also occur. Other common symptoms include bladder and bowel problems, dizziness and vertigo, sexual dysfunction, and cognitive difficulties such as problems with memory, concentration, and attention. It's important to remember that not everyone with MS will experience all of these symptoms, and the severity of symptoms can fluctuate over time. Section 5. Diagnosing multiple sclerosis. Diagnosing multiple sclerosis can be challenging because its symptoms often mimic those of other neurological conditions. There is no single test to definitively diagnose MS, so doctors rely on a combination of methods to rule out other possibilities and confirm the diagnosis. A detailed medical history is the first step in the diagnostic process. The doctor will ask about the patient's symptoms, their duration, and their pattern. They will also inquire about any family history of MS or other autoimmune diseases. A neurological exam will be conducted to assess the patient's nervous system function. This may involve testing reflexes, muscle strength, coordination, balance, vision, and sensation. The doctor will look for any abnormalities that suggest damage to the central nervous system. Magnetic resonance imaging, or MRI, is one of the most important tools for diagnosing MS. MRI uses powerful magnets and radio waves to create detailed images of the brain and spinal cord. Those images can reveal lesions or areas of damage to myelin which are characteristic of MS. A lumbar puncture, also known as a spinal tap, may be performed to analyze the cerebrospinal fluid, or CSF. CSF is the fluid that surrounds the brain and spinal cord. In MS, the CSF may contain abnormal levels of certain proteins and immune cells, indicating an inflammatory process in the central nervous system. Section 6. Treatment options for MS. While there is currently no cure for multiple sclerosis, a variety of treatments are available to manage the disease, slow its progression, and improve quality of life for those living with it. Disease-modifying therapies, or DMTs, are a cornerstone of MS treatment. DMTs work by modulating the immune system to reduce inflammation and the frequency and severity of relapses. There are many different types of DMTs available, each with its own mechanism of action, benefits, and potential side effects. Corticosteroids are powerful anti-inflammatory drugs that are often used to treat acute MS relapses. They can help to shorten the duration and severity of relapses by reducing inflammation in the central nervous system. Corticosteroids are typically administered intravenously for a short period. Symptomatic treatments are another important aspect of MS care. These treatments address specific symptoms caused by MS, such as fatigue, muscle weakness, pain, bladder problems, and cognitive difficulties. Medications, physical therapy, occupational therapy, and assistive devices can all play a role in managing these symptoms. The choice of treatment for MS is highly individualized and depends on several factors, including the type of MS, the severity of symptoms, the person's overall health, and their preferences. Working closely with a healthcare team specializing in MS is crucial for developing a personalized treatment plan that meets the individual's unique needs. Section 7. Living with MS, Lifestyle and Support. Living with multiple sclerosis presents unique challenges that extend beyond the physical symptoms of the disease. It requires significant adaptations and adjustments to daily life, as well as a strong support system to navigate the emotional and practical difficulties. Physical therapy plays a vital role in managing MS symptoms and maintaining mobility and independence. A physical therapist can develop a personalized exercise program to improve strength, flexibility, balance, and coordination. They can also recommend assistive devices, such as canes, walkers, or wheelchairs to aid mobility as needed. Lifestyle modifications can also make a significant difference in managing MS. Eating a healthy diet, getting regular exercise, managing stress, and getting enough sleep can all help to reduce fatigue, improve mood, and enhance overall well-being. Support groups can provide a safe and understanding environment for people with MS and their loved ones to connect with others facing similar challenges. Sharing experiences, information, and coping strategies can be invaluable in navigating the emotional and practical aspects of living with a chronic illness. It's important to remember that living with MS is a marathon, not a sprint. There will be good days and bad days. Building a strong support system, adopting healthy habits, and staying informed about the latest research and treatment options can empower individuals with MS to live full and meaningful lives. Section 8. Future Horizons in MS Treatment. The landscape of multiple sclerosis treatment is constantly evolving, offering hope for more effective therapies and ultimately a cure. Researchers around the world are working tirelessly to develop new treatments that target the underlying causes of MS, prevent disability progression, and improve the lives of those living with the disease. One promising area of research is neuroprotection, which aims to protect nerve cells from damage caused by MS. Scientists are investigating various strategies to prevent demyelination, promote remyelination, the repair of damaged myelin, and protect neurons from the inflammatory attacks that characterize MS. Stem cell therapy is another exciting avenue of research. Stem cells have the remarkable ability to develop into different cell types, including nerve cells. Researchers are exploring the potential of stem cell transplants to repair damaged nerve tissue in MS, potentially reversing disability and restoring lost function. Personalized medicine is revolutionizing the way we approach healthcare, and MS is no exception. Researchers are working to identify biomarkers or biological indicators that can predict disease course, treatment response, and individual risk factors. This will allow for more targeted and effective treatment strategies tailored to each person's unique needs. The future of MS treatment holds immense promise. With continued research, innovation, and collaboration, we are moving closer to a future where MS is no longer a debilitating disease, but a manageable condition that allows individuals to live full and active lives. Section 9. A hopeful outlook for MS patients. While the diagnosis of multiple sclerosis can be daunting, it is essential to remember that there is hope. Advances in treatment and management have significantly improved the outlook for people with MS, allowing them to live longer, healthier, and more fulfilling lives. Early diagnosis and treatment are crucial for slowing disease progression and preventing long-term disability. With the right treatment plan, many individuals with MS can manage their symptoms effectively, maintain their independence, and continue to pursue their passions. The MS community is vast and supportive. Numerous organizations and resources are available to provide information, support, and advocacy for people with MS and their families. Connecting with others who understand the challenges of living with MS can provide a sense of community, hope, and encouragement. While MS presents unique challenges, it is also a catalyst for resilience, strength, and a renewed appreciation for life. With a positive outlook, a strong support system, and access to quality healthcare, individuals with MS can embrace life's possibilities and live each day to the fullest.